Hi guys, welcome back. We're going to cover section C of chapter 17, which is basically pregnancy and delivery, birth of babies. Okay. So we last talked about the implantation of that zygote. Once it is implanted, the uterus starts changing, and there's a lot of things that go on. Okay. You're pregnant, you're technically pregnant once fertilization happens. But without implantation, the fertilized egg could just get flushed out, and the woman would still have her period, and so you might never actually know that you were pregnant. Once it's implanted into the uterus, that really triggers a lot of changes, and you're like really pregnant. I mean, you're still technically pregnant. Anyway, a full term pregnancy is about 40 weeks. We always talk about 9 months, but it's actually a little longer than that. It's about 40 weeks. And it takes that long for the baby to grow and develop inside of the woman's uterus. Okay. Now, once that implantation occurs, this organ called the placenta develops. And it's really like a filter kind of circulatory organ. And it's a bridge between the mother and the baby. So the baby's not eating at all. The baby's not breathing either. The baby's not using its lungs. And so the mother's blood comes to the placenta, and the placenta filters out the mother's blood cells, but it allows the nutrients and oxygen to pass. And then you can see these kind of blood vessels here. Okay, you can see that are going through that umbilical cord. I'll talk about that in a second. It's an artery and it's a vein, and so it can kind of go back and forth. The nutrients and the oxygen go through there, and they get into the baby's bloodstream that way. Okay. Now the blood does not mix, okay, because the baby and the mother could actually have different blood types. It's just the nutrients and the oxygen that are going through. Okay. Now, if the mother is drinking or taking certain medications or even drugs, that can get to the baby. And so it's very important to not do those things. Very important to check with the doctor what kind of medication is actually safe to take, because it will cross over to the baby. Okay. Also, after implantation, this thing called the amniotic sac develops, and it's a very thin membrane that kind of surrounds the baby, and it's filled with fluid, and it's just another layer of protection for the baby. If you've ever heard on a TV show or something like, "Oh, my water broke," what happens when a woman starts to go into labor, that uterus starts squeezing, and sometimes that amniotic sac breaks, and the fluid comes rushing out of the body. Okay, that means that it's time to have the baby. Okay, so that amniotic sac is there for the entire pregnancy until the baby is born. Now, the umbilical cord is literally a cord. It's like a tube that connects the baby to that placenta. So it's the connection between the baby circulatory system and the mom's circulatory system. And it attaches right at the belly button. Okay. The proper term for that is the umbilicus. And it's really nothing more than a scar from where that umbilical cord was attached. Okay. Now, this umbilical cord is incredibly important, but it could also sometimes cause problems. If the baby's super active, they can sometimes get kind of tangled up in it, and the umbilical cord might actually kind of get wrapped around, and it can cause distress. So it's something that the doctors watch out for, especially during delivery. Okay. At this point, well, actually, about the end of 8 weeks, we start referring to the baby as a fetus. Remember, at fertilization, it was a zygote. Then for about the next 8 weeks, it's an embryo. Now it's a fetus. Okay, we just call it a baby. All right, the pregnancy is divided into 3 separate trimesters. So the first trimester is about 1 to 12 or 13 weeks. Okay, and at the end of that time, the baby is about the size of a lemon. The first few weeks of this, the mom might not even know that she's pregnant yet. Okay, there's not really any outward signs. You might not know until the period actually stops, and so might not be aware of it right away. Okay, if you look on page 361 in your book, they show you a picture of a fetus. Looks like it's about 9 weeks old in that picture, and they said that it's about the size. Oh, sorry, about 6 weeks old in that picture, and it's about the size of a large pea. Okay, that's in the middle of the first trimester. By the end of the first trimester, the baby's about the size of a lemon. Okay. Second trimester is about roughly 14 weeks to 27 weeks. Okay. Lots of growth, lots of development, really starts to look like a baby at this time. The mother can start feeling the baby move at about 20 weeks. Bones and brain develop. You can actually see the baby sucking its thumb sometimes in some of the ultrasound pictures. And at the end of the second trimester, the baby is about the size of a head of lettuce. Okay. So the mother is definitely looking pregnant at this time. The uterus is growing. There's a lot more going on. Okay. Then we get to the third trimester, and really the third trimester is pretty safe. The baby has gotten to a healthier size. Doesn't mean that it's totally safe if the baby is born this early, like at the beginning of the third trimester. But it's very rare to have miscarriages at this point. It could happen, but it's more rare. Okay. The mom's probably getting pretty uncomfortable at this point because the baby is getting so big. This covers about week 28 to the end, which is delivery. Okay. The baby will grow hair during this time. It will open its eyes. It sleeps, has hiccups, all kinds of activities, rolling around in there, lots and lots of movements. And by the time the baby is born, the average weight is about 7.5 pounds, but a healthy weight is considered 5.5 to 10 pounds. Okay. Now, a baby can be born earlier than that. The earliest a baby has ever been born and survived is 22 weeks. There's probably a lot of health problems that go along with that, though. Really want the baby to get to like 37, 38, 39 weeks, okay? Because that gives the lungs as much chance to develop. The lungs are one of the last things that develop in babies, okay? All right, so the baby has to be born. So the first thing that happens is labor. This is when the uterus, which is got all kinds of muscles with it, it starts squeezing, it starts contracting, and the mother feels this, and it's very uncomfortable. And that's supposed to say stronger, not stringer. As the labor progresses, those contractions are going to get more intense. They're going to get more uncomfortable, and they're going to get closer together. Okay, the cervix also starts opening up. So the water might break at this point. It doesn't always. And that's the dilation sometimes you hear about on TV. Okay. The cervix is going to dilate. It's going to open to about a 10 centimeter width, which is that much. Okay. So still, like, that's a little bit smaller than a baby's head. Okay. So there's still a lot of effort that goes into getting the baby out of the uterus, out of the cervix. Okay. Then we've got delivery. Okay. This is when the mother starts pushing to get and helping. The uterus is still contracting, but actually have to push the baby out. The baby then will come out of the uterus, pass through the vagina. That's the birth canal. And it's in a good healthy delivery is head first. Okay. You want the baby will position itself normally, usually, so that it's head down, the head comes out first. It is possible for babies to be born what's called breech, and that's butt first. So the legs are kind of folded up, and then everything's just kind of backwards. And it's possible, but doctors prefer head first. It just works better. Now the nice thing about a delivery like this is it kind of squeezes the baby as it comes out, and it helps get some of the extra fluid out of the lungs. Okay. At this point, the umbilical cord will be clamped and then cut. And they just leave a couple inches there that will dry up and scab up, and in about 10 days fall off and leave the belly button behind. You have to clamp it because it's actually blood vessels. Okay. So if the umbilical cord gets cut, the baby could bleed through that, and they could bleed through it a lot, and it could be very dangerous. So they'll clamp it on both ends and then cut in the middle. And oftentimes they'll let the dad do that if he's interested. But then we've got another stage of birth, and it's called afterbirth. That placenta will then separate from the uterus, and it actually has to be delivered as well. It has to come out. That doesn't take much effort. The uterus pretty much is still squeezing, and we'll get that to come out on its own. And then birth is over. Okay. If you've ever heard of a C-section, the C stands for cesarean. It's named after the doctor that came up with this. That is surgical removal of the baby. So maybe the baby isn't upside down. Maybe the baby is having trouble breathing. The umbilical cord might be wrapped around the neck. There's any number of reasons a doctor might decide to do a C-section. Okay. And that's actually surgery. And they go in through the mom's belly and then open the uterus and take the baby out that way. Okay. So that's also pretty common. Multiple births. There's all kinds of crazy things that can go on naturally and with infertility medication. So fraternal twins are non-identical twins. You could have a boy and a girl. You could have two boys, two girls. You could have triplets. They are completely separate individuals. So what happens sometimes is more than one egg will come out of the ovary. If they're both, or if all of them are fertilized, it's different sperm, different eggs, so different DNA. It's no different than having, siblings born a few years apart. Fraternal twins are no different than siblings that are actually born from separate pregnancies. Identical twins actually come from the same single egg. So an egg is fertilized. A single egg is fertilized with sperm. It's got its DNA. That egg will start dividing, right? Well, sometimes, and not exactly sure why, but sometimes after it divides, it will separate and keep dividing on its own. So it'll separate into two separate embryos, and then those will keep dividing. Okay. So that is identical. It's always the same gender, and they literally have the same DNA. Okay, because they were made from the same chromosomes, the same mix of chromosomes from the egg and the sperm. Okay. Now, sometimes that split doesn't happen all the way. So something triggers, instead of just the cells dividing and then dividing, that egg divides into two separate embryos. That's identical. Sometimes it doesn't split all the way. And so you've got these two embryos that are stuck together, and those cells on each of them are going to keep dividing and grow two babies. Okay. So you can see the picture there that those twins, and they're identical because this came from a single egg, are stuck together at their bellies. Babies can be stuck together at their heads, at their kind of like the side, their shoulders. Sometimes they share organs. Sometimes they can be separated. It's drastic, extensive surgery, but sometimes they can be, depending on what organs they share. Let's see. Sometimes there's like in vitro treatment that goes along with this. We'll talk about that in class, though. Okay. All right. So then after you're born, you grow and you develop and you go through all these stages of life. Okay. So infancy is birth to about 2 years. Okay. And you become a toddler when you kind of start walking around, but it's still that first stage of life. And there is probably more growth and development in that first year of life than just about any other stage, except early teenage years. Your brain is changing as much as it was right after birth right now. But if you think of that first year or two, I mean, you have to learn everything. You have to learn to crawl. You have to learn to walk. You learn to talk. You just learn to like pick things up, learn to feed yourself. Lots of growth and development in that first stage. Then you enter childhood, which is about years 2 to 12. Elementary age, then the dreaded adolescence, the teenage years. Okay. So adolescence is mainly the teenage years. It goes into adulthood, and it kind of, there's some discrepancies on when you're an adult. You're allowed to drive and get a job when you're 16. Does that make you an adult? Legally, you are an adult when you turn 18. You can vote. Okay. The law looks at you differently. You can't buy alcohol until you're 21. So at what age are you technically an adult? You're not a teenager once you turn 20, just because of the numbers. But your brain isn't totally developed. Your brain is still changing and growing and developing until about the age of 24. But that seems kind of old to consider somebody still an adolescent before 24, because they probably have a job, they might have a family, they might even have kids of their own by that point. So there's a little bit of gray area there. And then you go to old age. Sometimes that's referred to as geriatrics. Your body technically starts aging at about the age of 30, but that's not old. Okay. I don't think I'm old yet. I'm middle-aged. So there's not a clear kind of determined number when old age starts. But as that aging increases and wrinkles appear and body starts changing in different ways, then that is the final stage of life. All right. All right.